Using Knowledge Management Techniques to Improve Workforce Transitions, presented by Angela, Mandy, Craig, Amy, Latha, and Allie. Knowledge management can be defined as a set of methods and strategies for making a business's information readily available for decision-making and day-to-day operations by controlling how that information is organized and shared throughout the organization. Knowledge management is useful in this situation because it allows employees to share knowledge, feel that they have a direct impact on the goals of the organization, and are free to create innovative solutions to business problems. Missouri Regional Medical Center recently acquired a long-term care facility. During the acquisition, the HIM department at the LTC facility merged under the direction of the medical center. The transition has not gone smoothly. The medical center employees are looking down on the long-term care employees, and they are resentful. Our team has been hired by the HIM director of Missouri Regional Medical Center to analyze their new workplace, evaluate possible solutions using knowledge management, and make recommendations to improve the functionality of the organization. The first problem with the merger is that some of the long-term care residents are being referred to the main hospital and are accompanied with incorrect charts. The major difficulty is that the hospital uses an electronic record while the LTC facility still uses paper charts. The LTC staff is adamant that the paper chart is fine and they do not have time to learn to use an EHR system. This situation should be evaluated using a knowledge management audit in the long-term care facility. The focus should be on the actual processes and knowledge needs of the employees to perform the processes. This will show where errors are occurring and what knowledge gaps are present. The facility should also look at and define a new structure for the organization after the merger. This should review differences in culture, the relationship between the facilities, and network needs for communication in the new structure. Some solutions to this problem include evaluating the situation and conducting joint problem-solving sessions where the medical center staff goes over to the long-term care facility to assist them in identifying and eliminating errors in patient identification. Secondly, the root problems should be addressed. Without EHR implementation, the long-term care facility will continue having problems with their record system. An EHR implementation will help them serve patients more efficiently. The second problem in this scenario is that the acquisition occurred with some cost to the hospital and a freeze has been placed on new jobs and equipment purchases. The medical center's HIM director has observed that the long-term care facility medical record department is severely understaffed, so much so that if one person is gone, the department comes to a halt. The equipment and computers used by the long-term care facility are also very outdated. Some ways to evaluate the situation include observing the workflow of knowledge within the organization and teaching the employees how to invest in internal assets, such as capturing tacit knowledge and converting it to explicit knowledge. The employees could also assist the department and staff by identifying internal existing problems about wasteful spending. They should determine what knowledge management tools to use to create Solutions to this problem include encouraging employees of the HIM department to become part of a community of practice to help find solution ideas for their particular situation. Changing responsibilities and redistributing work more evenly would help the department so that they are not in complete disarray if one employee is absent. The department should study and understand how understaffing and inefficient equipment are hindering their productivity. They should also reevaluate the budget to identify any wasteful spending in order to make room for The implementation plan begins with managers assessing the results and findings of the knowledge management audit. After this, management needs to express their goals for change and encourage buy-in for the changes from employees and consider a system champion if there is anyone particularly interested in the upcoming changes. The policies and procedures for the facility will be updated to improve knowledge sharing. EHR implementation will begin by contacting the appropriate people within the facility to identify and select an EHR vendor. The facility should begin planning and implementation of an EHR once the system is selected. And finally, the facility should conduct training for the long-term care facility employees about what is an EHR and why they are important. In implementing knowledge management, the facility should create groups that include members from each department level to discuss current practices and address necessary improvements. These groups may work with other groups and use brainstorming to come up with new solutions. The facility should also support systems thinking, which is known for addressing problems as a whole rather than seeing problems as specific incidents. The managers should concentrate on overall improvement of the department by increasing productivity, revenue, and efficiency. And as the hospital merges with other facilities, it is important to reassign duties because job responsibilities will be changed and employees should be utilized to their full. Our consultant team identified problems such as incorrect charts, inconsistent records, and lack of buy-in for the EHR. We use knowledge management audits and observation of workflows to identify these problems. We suggest implementing communities of practice and EHRs along with training the long-term care employees. Here is a list of responsibilities performed by each group member. Thank you.